Vigilance AI. Alert, act, prevent. The problem is that there are undetected infections in seniors which can lead to expensive and preventable hospital stays. This starts with a senior experiencing early symptoms such as low appetite, low energy, increased sleepiness, and confusion. This can cause a delay in care between 6 to 9 days, which can cause continued discomfort and worsening symptoms. This can lead to ER and hospital stay with labs and imaging, which can take up to 4 to 5 days with around $5,000 per day. This can further increase the risk of infections and cause emotional distress. Then, in home health or nursing homes, these are treatment plans. However, here is where the cycle repeats, with high rates of readmission, and this can be physically, emotionally, and financially taxing. The days of treatment are between 10 to 14 days, with the hospital cost of 20 to 25,000. Our computer vision models identify UTI and pneumonia in older adults. Vigilance AI is an information service to providers for early detection and intervention. The solution we have is proactive care, which enables faster responses, reducing and preventing hospital stays. First, the senior experiences early symptoms, as mentioned before: low appetite, low energy, increased sleepiness, and confusion. Vigilance AI then alerts doctors and families, which can take 1 to 2 days, and alert of change in pattern. Then, the evaluation at home with labs and imaging can take 1 day and cost about 1.5 thousand. Then we start the treatment plan, and this reduces the risk for readmission. The days of treatment are between 2 and 3 days, and the hospital cost is 1.5 thousand. The patented technology is a computer vision based product to proactively identify signs of illness like UTI and pneumonia, including environmental hazards which may result in a fall, such as spills, objects on the floor. We can also identify the latest behavior, and you can see a summary of behavior analysis. We can also identify behavior so patients and family can reduce the risk of hospitalization with a better peace of mind with preventive and proactive care and the prevention of elderly abuse. The privacy aspect is that the data is secured locally and it's HIPAA compliant. It is also sensitive for elderly needs and has an automated activity summary. This can show gait abnormality, cough with oral intake, breathing pattern and sleep patterns, fire and other environmental hazard, spillage, and fall hazard. As you can see here, this is a demonstration of the product. We see here a few things. First, we can see the inferences of the senior sitting in the bed. Currently, we can see he is sitting and sleeping. Then we can see he's sitting and standing. Then sitting and standing again. And this continues on. As inferences increase from 1, 2, 3, 4, and 5, it can determine the highest inference, whether it's standing, it's eating, or whether it's sitting. As we can see here, the senior is currently eating. As we can see here, it's stating that it's 54% eating and 41% standing. It can also measure coughs, as it just mentioned and saw the senior coughing, and we can see how it affected it. We can also see drinking, as we see the inference here, showing the drinking of 95% and standing of 5%. It continues like this, as we can clearly see the AI model taking the inferences and putting them to use. This can help doctors and analysts to see how seniors in their homes are acting, and in case they may fall or get injured by some outside source, then they can also know that by the inferences that the model presents. As we see here, we see a combination of eating and standing, and now the senior moves back to the bed as he's standing, and we can see him also grabbing for a few things as the AI models send that as falling. This is how the AI model works, using the inferences to determine the main aspects of the senior to a good degree.